Welcome to EmpowerHer. Our hope is this podcast will empower women to take control of their health by providing them medically accurate information that is needed when making a decision about their pregnancy. Remember to subscribe.
Well, last month we discussed the abortion pill. Today we're going to talk about surgical abortion. And once again, this topic can be triggering to some women. And if so, we encourage you to reach out to a counselor or after abortion support, like supportafterabortion.com, or locally, you could reach out to Muskegon Pregnancy Services.
So, Darcy, what is a surgical abortion?
Well, a surgical abortion is a surgical procedure that will terminate a pregnancy. There are different types of surgical abortions, and that depends on how far along you are in your pregnancy. That will determine the type of abortion procedure that they'll administer to terminate that pregnancy.
What are the possible risks?
Well, there's several risks of a surgical procedure or abortion. Heavy or continued bleeding, infection, sepsis, incomplete abortion, allergic reaction to drugs that are given, damage to the cervix, scarring of the uterine lining, perforation of the uterus, damage to internal organs, increased risk of breast cancer, even death. Abortion is linked to subsequent preterm births and increased risk for mental health issues. So abortions can affect future pregnancies. So there can be scarring or other injury during an abortion procedure, and that can prevent or place someone at a risk of future wanted pregnancies. And then those that have had an abortion in their past, it increases the risk of miscarriage for those post-abortive women. So,
What should someone do before having a surgical abortion?
Well, there's three things that they need to do. They first need to verify that they have a positive pregnancy. Second, they need to have STI testing. And then they also need to have an ultrasound, so that ultrasound can, one, determine how far along they are in their pregnancy to determine the type of procedure they're going to have. They're going to determine whether or not that pregnancy is even in the uterus, and then they're going to look for viability, meaning a heartbeat.
So what if it's not viable, then what?
If they don't have a viable pregnancy, then they don't need to have a surgical abortion.
That would save them some money.
It does.
Yeah.
Definitely.
Why is it important to rule out STIs before having a surgical abortion?
Well, if you have an STI, the surgical instruments that are used during that procedure can introduce that infection up into their uterus during that procedure and then cause further complications.
So should someone follow up with a medical professional after having a surgical abortion?
Yes, they should. The reason why they need to do that is that they want to ensure that, one, the surgical abortion completely emptied the uterus. If it did not, it can cause an infection, sepsis, or even death.
Well, thank you, Darcy, for providing that information for our viewers so that they can take control of their health when making that pregnancy decision.
So if you are pregnant and abortion is the option you're considering, please make an appointment at Options Women's Care Center, where your health is our top priority. Our no-cost services will be performed by a licensed medical professional, someone just like Darcy. And Options Women's Care Center can provide you with that pregnancy test, limited ultrasound to determine the viability of the pregnancy, and will provide you with the information and support that you need.
Well, thank you for tuning in to Empower Her, and don't forget to like and subscribe.